All right, so this is the hip HOPS. So Megan doesn't have any hip injuries, but here are some of the questions I would ask for history if she did. I would ask how she heard it, so the MOI, if there was any pain, what caused it, is it radiating down the leg, severity 1 to 10, how bad is it, what's the quality, so is it feels like catching, or burning, or tingling, or stabbing, dull, aching, anything like that. Also, I would ask, what provokes it? Is it worse standing? Is it worse sitting down? Is it worse when you're walking, running, stuff like that? And then time, how long has it been hurting? Does it hurt for a while and stop and start again? Or anything like that. Also, signs and symptoms, allergies, medications, past injuries, if she's ever hurt, ask if she's ever hurt the hip before, what happened if she did, last oral intake, and events leading up. So if it's an athlete on the sidelines, you want to find out what happened leading up to the injury if they can remember it. All right, so now we'll move on to observation. Oh, also, you want to ask if there's any clicking, catching, clunking, or anything like that with the hip, and if it is the dominant leg that she's hurt. So she's right leg dominated, so it's not her dominant leg. So observation, I'd ask her probably to pull up her shirt if that's all right with you. Maybe pull down her shorts, look through her hip, see if there's any bony abnormalities, swelling, discoloration, bruising, anything obvious that looks like it requires attention. Now we'll go into palpation. So I'm gonna palpate through her hip, that's all right. So you wanna compress through the femur, or through the pelvis, sorry, and feel both sides of the pelvis, front and back. Putting pressure through to see if it causes any pain. And then we'll move through the femoral shaft, compressing as we move down the leg. Any pain with that? No? Great. Now we'll move on to special tests. We'll do active first, so I'll get Megan to stand up for me. So we're gonna do flexion. So I'm gonna ask her to bring her hip up as high as she can go. Okay, and can you do it with the other one too? I'm using both sides to compare if it seems unequal or not. Okay, bring it down, and then can you bring your leg back? Yeah, like that. Okay, and then can you do it with the other one? And we don't want them so much that they're tilting forward. It's just slightly back, so you can see how far the leg goes back. Okay, now we're gonna get her, just step a little bit this way. We're gonna get you to bring your uninjured leg out as far as you can without tilting. Try to stand upright. Yeah, it might not be very much. Yeah, and then can you bring it back in? Any pain with that? No? Okay, now we'll get you to do your injured side, same thing. Come out. And then no pain with that, and then come in and across. Is that okay? Awesome. And then we'll do internal, external rotation. So can you rotate at the hip, in, how does that feel? Good. And out. Okay? And then uninjured. I'd recommend doing the uninjured side first because they'll have the highest range of motion, and then you can compare it to the other side. But either works. And now we'll do passive range of motion, so I'll get her to lay down on the supine. So now I'm gonna move your leg. So I'm just gonna bring her leg up, see how far, just let it go, relax. So she's pretty good. And we'll do the other side too, to compare. And then extension, I'm actually gonna get you to roll onto your side facing the couch. So I'm just gonna hold her hip, bring her hip back, see how far she extends. Pretty good. And then we'd also do the other side. With the couch, I don't have enough room to go the other way, so that's what I would do if I had the space, but unfortunately here I don't really. So I would just try to get her to kind of turn on that side again. But I'm just gonna try to move your bottom leg a little bit. It's a little bit more awkward, and the hips will tilt a little bit, but with what I have, that's what we're gonna have to do. Now I'm going to raise her leg into abduction. How does that feel? Good. Okay. And then we can also see adduction because she's bringing her leg back in, and that feels okay. And then flip one to me again. And now I'm going to do the other leg. How high can she go? And then adduction is tested there. All right, and then flip on your back. We could test internal rotation here too. So like that, and then external, and then also with the uninjured side. All right, now we're gonna do resisted. So bring your leg up. I'm gonna push. Don't let me move you. How does that feel? Good. Okay. Keep your leg up. Now I'm gonna, don't let me move you. Will you? How does that feel? Good. Okay. And then this leg up. Don't let me push. All right. Don't let me move you. Oh. Good. 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 All right. Now we're gonna do adduction, abduction. So roll on the side again. And extension. Don't let me move you.
Oh, jokes.
And now don't let me move you. All right. Now don't let me move you. Up. Don't let me move you. Nice. All right. Now we'll do internal rotation. Don't let me move you. All right. Don't let me move you. Nice. Nice. Good strength. All right. So we do it with both sides. I only did it mostly with the injured leg just because of the space that we have, but you try to do it with both sides. All right. That's it for a HOPS for the hip.